foundation for all of Asia. Dr. Sam, what a wonderful friendship we have with you and Susie, and thank you for your long support. It's good to have you with us.
Prevention of starvation among HIV/AIDS patients in southern India. Thank you for the opportunity to be part of this Zoom call. Dr. Mesa, Mr. Chin, and co-speakers, ladies and gentlemen. Several requests were made by our patients and family members of them for food rations to be given to them. They were finding it difficult to purchase food rations to prepare meals. Majority of them are daily wage earners and they depend on their wages for survival. Since lockdown, there is no work, no agricultural extension work, and no activities in rural villages, and no wages. No wages equals no food. It is customary for men to go to another state or another village or another town to find job, and that too wasn't coming. Some mothers explained that if any food was available, it was given to their children. At this time, Dr. Mesa sent us a message asking us to enumerate the number of our clients who have no food and are starving. Dr. Mesa acted so fast, and we thank him for this initiative to fill a vacuum. Even local authorities were slow to come to the rescue, while a group from Denver acted so swiftly. After Dr. Mesa's intervention, several women and children are not going to bed on empty stomachs, but with solid food. Thank you, Dr. Mesa, and all at the center for caring for our patients and their children. We know they are infected with HIV, but we don't know what proportion of them are COVID-19 positive. Our program in southern India was started in 2008. We observed that large number of long-distance truck drivers were in Namakkal, and this resulted in Namakkal having large caseload of HIV/AIDS. The district has a hill area where tribals live. Besides HIV infection, they're anemic, worm-infested, and malnourished. With the help of the center, at this time, we prevented starvation in 6 groups of clients: AIDS women, AIDS men, AIDS children, elderly blind women, disabled children, and those families who are ostracized because of their religious belief. And our new program, Sewing School Students. What did they receive? They received rice, they received sugar, they received lentil, they received cooking oil, fresh vegetables. They haven't had it because they can't walk to go to a market. And there was, for public transportation, we have given them 200 rupees per person, and for a child, 50 for them to go in and out. How long will these rations last? Some of you may wonder. They will last for about 25 to 30 days. Total number received these food rations is 163. In Namakkal, at the Mesa Center for Women and Children, 113 of them, 88 women, 16 men, and 9 children received these rations. In Hills, in Sengarai, 50. AIDS men 10, AIDS women 15, eye clinic patients 4, tailoring students 7, and others 10. Balance of funds available for the next tranche is about 1,180, but we know these are inadequate. What have we learned from this experience of going around giving food to people at this time in the era of COVID-19? What is it to be hungry, children starving and crying for food? There are many seniors in the community who need support, younger members of the family who do not care about the elderly. What about the future? Will you include food service in your programs? Dr. Mesa, you and your center's prevention of starvation is a real people-centered program. Thank you for making our men, women, and children hunger-free. Thank you very much.
Thank you, Dr. Sam. You would be thrilled if you knew all the people on the watching today, because I see some former student who was with you in Namakkal, as well as other visitors to your center in India. But I will move on now.